Okay. Yes, I'm Claus Duedahl Pedersen from Odense University Hospital, where I work with telemedicine and innovation, in short. And some of you know the hospital, some of you probably don't. But to say it's short, it's really big, it's very expensive, and it's pretty ugly. This is the hospital that we're working in at the moment, and this is also the hospital that we are going to rebuild, and going to build a totally new hospital within 10 years or something like that. We should be moving away from the center and out to the university. And that is one of the challenges that we are facing, and why we are in this game about innovation and games as a tool for this. I would also like to put out a general statement about what we are doing and what we are thinking about. There is, as one of my good friends says, there is no IT projects or development projects. There are only business projects, meaning that whatever we do has to give meaning for the basic business that we are delivering. Whatever we do has to fit into the way that we want to deliver care or delivering care at the moment. So this is something that has to help the system, the business that we are producing now. So we don't have any IT projects or innovation projects. We only have business projects, and that is what we are facing at. How can we improve our business development, and how can we deliver business in a better way? So, looking at the trends and why we need to go into this weird area about games, serious games and gaming technology and all that stuff, is that we are facing a lot of challenges. What we see is the whole healthcare system is being more and more centralized. We are reducing the time that patients are in the hospitals. Actually, they have to be unconscious when they come in, and they have to be unconscious when they come out. We have decreased the time that patients are in the hospital dramatically over the last 10 years. We treat more and more patients out of the hospital. We are getting older as a population, and we will have more patients in the future, and we will have less people to take care of them. And we have to be better to actually avoid people getting into the hospital, so prevention will be a major player in the future. And then it's something that's only interesting for us is that we need other ways to finance the services that we are delivering in the future. What we also see is that when we look into the future, there will be a new division of work between what the hospital are doing and what others are doing. There is no doubt that patients and relatives will have to play a more active part in the care and treatment of the people. This also means that they have to have other tools, other means to do that with. Simply because there is no others to do it. We will also see that there will be an increasing gray zone between the secondary and the primary care, meaning that patients that at the moment are treated in the hospital probably in the future will be treated in their own home or in the home care system, but still need the specialized competences that are in the hospital. We also see that there is we need to find new ways of collaborating between hospitals, between the highly specialized hospital like the university hospital and the more general hospitals that are in the rest of the region or otherwise. And then there is an increase in tendency through that we will have a private market of specialists and private providers of that we need to collaborate with. So that's one of the challenges that we are facing, and that's why we need to find a different way to work. What's also important is when you work with innovation and with new ways of doing things and a lot of exciting ideas how to change the whole world, is that a hospital is a really big and ugly thing, and it doesn't change overnight. And we have a infrastructure that you have to relate to. You have to understand that you cannot just replace everything in the hospital system. So you have to acknowledge that we are part of an infrastructure. We are part of a national infrastructure when it comes to communication. We are part of a national infrastructure when it comes to video conferences and so on. So there is some basic infrastructure that you have to take into mind when you want to develop services and solutions for a hospital system. We have internally in the hospital an IT infrastructure that will not be replaced just because we are building a new hospital. We will carry on with a lot of the systems for many years, and this is something that you have to bear in mind when you try to make a revolution with a totally new way of delivering healthcare. Is we don't change that fast. So be aware of that you have to adapt to an existing system, whatever you do. In our mind, when we are working with the challenges that are coming up, we have some concepts that we think is worthwhile looking at. And one of the concepts is what we call the virtual workplace, meaning that we will, through video conference, through different kind of tool, have access to be collaborating and working together across physical entities, across departments, between the hospitals and the home. If some of you have been participating in e-health conferences for many years, this has been set, I think, at least for the last 10 years, and for the last 9 years it has been a wish, but in reality now it's here. We have the infrastructure, we have the technology available that makes it possible for us to do that. That of course has some implications. We will have video conference anytime, anywhere. We need to have access to data anytime, anywhere we are. We have to have new tools to learn and develop our staff with. We have to be able to exchange clinical data across any kind of premises. And we also have to have new collaboration models between the hospitals and the patients and the primary sector. So that's here now, and we are using it in daily life. What we also see, which is not so close to daily practice now, is the more active involvement of the patient. We will see that patient will be more and more involved as a co-producer of the services. They will provide us with data. They will carry out clinical processes. They will have a more direct communication with the specialist, and they will be treated from the hospital in their own homes. That means that we have to work with a totally different set. We have to be able to integrate services or solutions that are in the patient's home. We have to give patients access not only to read the data in the electronic healthcare record, but also to enter data in the electronic healthcare records. And we have to find new ways to manage this and the adaptation of these data. And of course, we need new tools to have an interactive communication between the healthcare sector and the patients. And one of these tools could be really well based on the game technology or whatever is available there. And we need to find a new way to use, or actually start using, the social media like Facebook or whatever, because that is something that is not present in the way that we communicate today from the hospitals. If you look at hospitals in Denmark, I think there's only 4 or 5 hospitals that are actively using Facebook in any kind of communication with their patients. I think at some point in time the patients probably will be tired of us being so slow, but that's coming up. And of course we also see the gaming technology as one of the possibilities for giving us another tool in the box to deal with one of the many challenges that we are facing. We see it's game technology or games used as a motivation for chronic patients, for people in rehabilitations. But we can also see that it's possible to use games as a tool for diagnosis, as a tool for treatment, and of course for information and for prevention. So we see possibilities in using the interactiveness and the motivational part of the gaming technology as one of the tools that we need to have in order to deal with the challenges that we are facing. The growing number of chronic patients is definitely one of the main sources for this. We also see that technology that comes out of a total different setup can be used directly in the healthcare system, as for instance the augmented reality can be used as for operational planning. So technology developed for something totally different can be changed and used in the healthcare system. We see that sensors and sensor technology will enable us to change the way that we deliver healthcare. In reality, taking patients out of the hospital, bringing them in their home and doing the same analysis, the same diagnostics as we do in the hospital. When we are building the new hospital, I think we will have around 30% less beds. Is that correct? Which means that we are already on a very short time frame when you are admitted to the hospital, which will have to be even shorter, or we have to bring some of the patients that we today have in the hospital out of the hospital into their own settings. And a technology like an e-patch, an electronic plaster for ECGs, will enable us to treat and diagnose patients in their own home for heart failure instead of having them in the hospital. That is something that will change a lot of the way that we deliver care. We also see that, and that's also very much coming out of the game technology, that different kind of virtual resources could be made available, meaning that we don't necessarily need to have people to talk to the patients, but can build on intelligent solutions where this could be the receptionist in the hospital pointing the way to where your department is, or doing interactions with psychiatric patients on the screen based on intelligence algorithms in the answers. So there is a lot of good ideas to use that. Another area that we are slowly but securely have to deal with is the whole mobile technology that is coming into the hospital. It has two advantages. One is that it gives us access to the staff anytime, anywhere, because they can carry around with a lot of information. But secondly, when we look at the potential for bringing knowledge and service to the citizens, they will buy their own equipment. We don't have to buy video conferences or mobile phone to them. People buy smartphones anyway, so why don't we use that as a tool for bringing services to the patients? A very good example of this, if you don't know it, in California you can sign up if you're able to help in case of heart failure. You can register, and the local fire department will then send out a message to you if someone has a heart attack close to you. You'll be guided to the nearest place if you have signed up for that. So there's a lot of possibilities of including the public and the citizens in the providing healthcare and providing services to them. what is really important when we are talking about new solutions, new ways of delivering care, is that when you are dealing with a hospital and a healthcare environment, we are evidence-based, which means that we don't change a lot unless there's really good scientific evidence behind the changes. That also means that it's not enough to have a good idea. It's not enough to develop good solutions. If you can't prove that it actually helps, if you can't prove that it actually helps the patients or improve the economy in a robust scientific way, it's very difficult to get anyone in the healthcare system to buy into it and to sell it. And that makes it really annoying for any company to work with a healthcare system because it takes a lot of time. You have to plan for having clinical studies, you have to plan for getting your documentation in place, and you have to do that in a relatively early stage of your development. And that is, in reality, can be extremely expensive and takes a lot of time. On the other hand, you just have to say it's really difficult to do anything else, to do without in the healthcare services, unless you're able to prove it. We have solid tradition. Actually, we have a rule in the hospitals that we don't change unless there is evidence behind the changes. So when you are thinking about developing technology-based services that should change or improve the clinical services that we are providing, you have to include evidence production as part of your development. Yes. At Advertise, any one of you should be interested. There are some really interesting chapters in this book about how the healthcare system will change in the future. I can say that because one of my colleagues has been writing an article in that. You can go and find it there. Yes, I think we have.
That was pretty much bang on time, actually. Very efficient.
Thank you.